Joining me now, MPP for Hamilton Centre, the official opposition shadow minister for mental health and addictions, as well as a frontline family physician to discuss the critical public health issues facing our city. Please join me in welcoming MPP Dr. Robin Lennox. Robin, nice to see you today.
Nice to see you. Thank you for having me.
Yeah, nice to see you. Last time I saw you, you were in this studio. Your first time ever putting your hat into a political ring.
Yeah.
Studio looks a little bit different, but welcome back.
Thank you very much.
And with that said, how has this transition been for you?
You know what? I think it's actually gone really, really well. I think, as much as sort of being in medicine is different than being in politics, I've always lived by those words that politics is just medicine on a grander scale. And so I try to apply sort of the same principles that I brought into my medical practice to this sort of practice of politics.
You're front and center with a lot of what's been going on in our healthcare.
Yeah.
Our healthcare, it then trickles down to housing. It comes down to affordability.
Yep.
I know there's no crystal ball you can look into and snap your fingers and say, let's get it all fixed. But what are some of the biggest concerns? What are some of the biggest things that you have been hearing now that you're kind of on the other side of things?
I think, when I talk to people in Hamilton and, across the province, it's really consistent. The two biggest issues that people have that they want us working on are healthcare and housing. Yep. And so it's no secret that we know, our hospitals are in crisis. Many of them are running deficits. We see patients overflowing into hallways and even into chairs in the emergency room now. And we know that many patients still don't have access to primary care in their communities. So that's absolutely a big focus of ours, is trying to come up with a plan both to fix our hospitals and to make sure that community care is well resourced to keep people out of hospital, to keep people healthy in their lives. So that's a big focus of mine right now.
And so we were just talking about this, and we'll bring it up now. When families play off what's going on in a hospital, and if you're having surgery or something's going on in the hospital and you're there and you're not getting the answers, sometimes the families get on the nurses a little bit, and they don't necessarily have all the answers too. There isn't an even ratio, it seems like, and I don't know for what reason that is. I don't know if you can explain it.
Yeah, I think there's many people in our hospitals and family members who have someone in hospital, I think, are picking up on the stress in the system. And particularly at a frontline level, we know that our hospital nurses are completely overburdened. Oftentimes they have way more patients on their load than they can handle. And so we need to bring in mandatory, safe nurse to patient ratios, not only to, improve the quality of care that our nurses are able to provide, but we also know that it actually saves lives. When we study it, it actually reduces mortality on the wards. So that's an essential thing that we need to start moving in.
Is there room in the budget for something like that? How does something like that get put in place, and then you can maybe run it on a pilot project?
So it's actually something that's been implemented elsewhere, and so we can learn from other places, but we do have the money in the budget. Right now, we could create more good, permanent, unionized nursing positions in hospital, and if we increase the reliability of those positions, make sure that the working conditions are good, we're going to decrease our reliance on temporary agency nurses, which actually cost us a premium. So we've spent billions of dollars on agency nurses over the past decade that could go into good, permanent nursing positions in hospitals to make sure that we have enough nurses for every single patient.
Hamilton Centre, it's an older part of the city. It's a vibrant part of the city. A lot of old, a little bit of new. Seen some condos go up and everything. But affordable housing, man, oh man, that's another one. I think a lot of these condos that you see out right now, they're up there. A lot of them are still empty right now.
Totally.
What's the solution? What's the cure? What are you and the team talking about in the caucus about this?
I think you've made a great point. We do have some housing stock available, but it's not the right housing at the right cost for people in Hamilton. So where we're at right now is we've actually seen sort of a failure of the housing market to provide the deeply affordable housing that people in Hamilton need. Our solution in the Ontario NDP is we want to put in place something called Homes Ontario, which would be a dedicated agency within the government that is there to build non-market housing. And what what that means is basically looking at alternative forms of housing like co-ops, like geared to income, like supportive housing, to really be able to drive prices for housing to be actually affordable and ensure that we have someone actually building that who has the lens of, you know, a public builder using public land to deliver housing that people actually need.
As the official party to the opposition, I know those tasks can be Herculean at times when you have a premier in the PC party like Mr. Ford. How can you get this moving?
Yeah, it's very difficult with a government that, you know, they are serving different interests than we are. You know, our best interest, our greatest interest is making sure that people's basic needs are met. You know, in this province, if you're working full time, you should be able to afford rent, to afford groceries, and to afford your medication. And we know that for too many people, that's just not the reality. I think what our work is to put forward solutions, really great, evidence-based, reasonable, cost-effective solutions, and then be able to build enough public support around those that they become voting issues and the government wakes up and listens.
Another thing I wanted to touch on was mental health and awareness. I know it's a big one. What I am finding and have been hearing more and witnessing myself is, you know, doctor will take you in, you got your 15-minute appointment, the tablet will listen to you now because it's all AI-based for their notes, and they'll write you a prescription and say, we'll see you in a month. How is that solving mental health just by continually pumping chemicals into individuals? I understand there's a need for it in some places. Is this the right way to keep going?
Yeah, I think when we think about, you know, mental health care, there's sort of a spectrum of options that we need available to people. Absolutely, there are a lot of great, really safe medications to treat medical conditions like anxiety, depression, you know, bipolar disorder, and others, and that's an essential component.
But after a 15-minute visit? After, you know, your first, here, I've been having issues, doc, here's what's going on, my wife, my kids, my dog, you know. Oh, well, here's some Zoloft, go for it. You'll be fine. Yeah,
I think we want to make sure that every tool is used in the right kind of situation. What we're missing right now in mental health care is truly universal coverage for the entire spectrum of mental health care. For example, we have sort of a piecemeal approach to mental health care coverage. Many people can't access counseling, for example, or psychotherapy. Different types of counseling or treatments for different conditions are available in some regions, but not in others. And even, you know, medications, like you mentioned, for psychiatric conditions, a lot of people don't have access to those medication treatments because they don't have medication coverage. And so I think what we need to do is actually establish a universal mental health care system that provides coverage for every tool that we need to be able to actually address the mental health crisis that we're facing.
Yeah, and I guess, again, in a perfect world, it would be wonderful to have all that going forward. But in the meantime, we don't. What are some other things we can do, you can do in your role, to help these people more now than in another 4 or 5 years? Because I can't imagine what the city's going to look in another 4 or 5 years if it keeps going in this trajectory.
I think it depends sort of which aspect of the mental health crisis we're looking at. I think what you might be highlighting is sort of the intersection between, you know, folks with severe, persistent mental health conditions and substance use as well. I think right now we're living in a very difficult time because we've seen our government roll back a lot of evidence-based interventions to actually try to improve the health of those folks. And right now, you know, what we're seeing in our libraries, on transit, you know, on our streets is a result of people really having nowhere to go and no services available to them anymore. So I would say that one thing we could do immediately is reverse some of the policies that have been in place to, you know, close supervised consumption sites, to ticket people in parks rather than actually investing that money in housing them. All those sorts of things that we've done have sort of taken us backwards. We could bring ourselves back to the present and then start expanding into opening up more supportive housing beds, ensuring everyone has access to good quality mental health care. Those are some of the things we need to do.
Unfortunately, we can't snap our fingers and have it all fixed just like that, but continue the good fight, continue the excellent work you're doing. Congratulations on being a new mom as well.
Thank you so much.